Hi, I'm Dr. Jeffrey Tucker, and we're here in my office in West Los Angeles, and I get to be with Annie and go through a postural evaluation. And the reason that we do this is to create awareness for the patient. And it's really an opportunity for me to guide her through some gentle movements, evaluate her fascial chains, and then use the HyperVolt and the HyperIce tools to see if we can make some changes in the fascial structures. So I really do like this foot approach. It begins with a visual analysis. I like to look at the feet to see if there's any bunion formation. We look at the arches. We want to establish what the heels look like and the Achilles tendons. The other thing that I would like to do is evaluate the ankles. So I'll ask Annie, just move your knees forward, Annie, and bend or do small knee bends. And we watch her to see if the knees are tracking. If I put a dot in the center of the patella, it should track pretty much over the second or the big toe. You might even observe that on her left foot, she did want to externally rotate slightly, and that's saying to us that she's having some tightness in that calf area. If I were to move up the chain, I like to look at their ability to move the hips into anterior and posterior pelvic tilt. So I'm just looking at her ability to move. I want to know if there's any pain. I also take the ASIS and the PSIS. If I were to take an imaginary line from her ASIS straight back to that PSIS, and that line that goes across should be approximately 5 to 8 degrees. If that angle is increased, then I know that she has an anterior pelvic tilt. If her pelvis was like 0 degrees, I would know that it's a posterior pelvis tilt, and that I would think maybe those hamstrings are really tight and holding her into a posterior pelvic tilt. So already we're getting a lot of information, whether it's anterior pelvic tilt, posterior pelvic tilt. I would look at her abs, look at the ribs to see if there's any rib flare, the position of the lumbar spine, and just moving our way up, I'm observing her breath as well. So Annie, go ahead and take a nice breath in and out a few times. Relax your hands. And this observation of breath is really important. I always cue my patients to nasal breathe. Breathe in and out through the nose. We don't want mouth breathing. We know that that can be detrimental, especially during one's sleep. And if I can't see it, I can ask her, Annie, what do you feel? Are you breathing through your abdominals? Are you breathing through the chest?
Abdominals.
Good. And we want that, but typically we do see a lot of chest breathers. We may see elevation of the clavicles, which would indicate tight SCM or tight scalenes. I particularly look at the position of the front of the ribs and her thoracolumbar area. And what we typically see is a rib flare, and that the thoracolumbar area is tight, it's dense. So we know that we would want to use our tools there. And moving up, we're going to have Annie turn around, and I always look at the scapula and the setting or sitting of the scapula. We know that the medial scapular border should be about 2 to 3 inches from the center of the spine, equal distance. We like to see the scapula nice and flat. We know how to diagnose scapular tipping or scapular winging, and those are key things. And as we go through some movement assessments, we'll see what happens in regards to that. Moving up, it is good to look at the shoulders. I like to look at the neck, and I always look at the head as well. So let's turn around this way. One of my first cues to the patients is go ahead and learn what the short foot is, or a foot that's well rooted. And patients will understand that. I want that equal distance or equal weight on 3 key points on the bottom of your foot. So weight underneath the center of the heel, weight underneath the big toe, and weight underneath that small toe. Those 3 points with equal weight on each of those really does make a difference in activating the nervous system. We always want to make sure that the knees are soft, they're not locked out or hyperextended. Help them get the pelvis in neutral. If you see that you may have an anterior pelvic tilt on one side, for example, and a posterior pelvic tilt on the other, you know that you want to correct that using the HyperVolt and HyperIce to release and balance out the fascial restrictions. I want to make sure that they're set in the diaphragm, their breathing is relaxed, and I put their shoulders in good position. It's not unusual to see, if we turn this way, Annie, that humeral head is a ball. And if I divide that ball into thirds, an anterior third, a middle third, a posterior third, it's easy for us to see that. If you see more than 1/3 forward, we would call that an anterior humeral head. And that says to me that these pecs are tight and overactive, and I need to use the tools to open that up. And I'll explain to the patient, look, because being at the computer or because of your work environment, you're doing this. The shoulders are going forward. It's putting abnormal tension and imbalance on these muscles back here. And this is one of the biggest postural fixes that we need to make, and bringing that awareness to our patients. So showing them and giving them awareness of proper posture is essential and the first things that we would do.